Hello, and so this will be the final part, the final demonstration, and this time I will be administering first aid on a compound fracture on the metatarsal patient. So, metatarsal itself is 5 long bones on the feet that is proximal to the tarsal bone and dorsal to the phalanges of the feet. And now we have here a patient that is about 18 to 21 year old. As he was having his yoga, an accident happened, and here what happened. Yes, sir. So while the patient is having his personal yoga at home, he was having a meditation and relaxation by his own. Unfortunately, with his rapid standing up, it happened that the strength of his leg nawala and may nag-cause ng pagkatumba.
Back swing isa.
Mansa ka sis? Kasi na itabo.
Tapi ko.
Sige ha, sige daw. Makaya din makahita ka karo? Sige daw, makaya ra?
Sige daw.
Relax lang. Sabayan ta ka. Karong higa, makaya din higa kay karo ha? Great, nice one. Sige. Asa ang sakit? Left or right? Right pati el. Sige. Sige, straight ka. Makaya mo straight? Yasista ka. Sige, nahinay lang. Great. Sige. Okay. Relax lang ha? Sige daw. On this part, in order for me to unveil which part of his foot has been fractured or injured, I will be removing any clothing that might cause the pain. But asa dapat pwede na may tutukas ang sakit?
Sa kilid.
Dire? Sige. Kaya nga tanggalon ang sapatos sila yung makaya ha? Tanggalon na ito, pananggalan ha? Sige, inalang ang sakit sa kayo. Kaya? Sige, relax lang ha? Kaya ha? Okay, natanggalan na ako ang sapatos. So now, I was able to unveil the foot of our patient, and upon initial survey, as I opened the shoes of the patient, blood flow has been notable. Nagadugo ang iyang samad, which means that this is an open fracture after that bad fall as he was about to stand up a while ago. So first things first, let's follow the Dr. ABC, and I shall secure the place away from the danger. Remove ang mga possible stuff na pwede makakause of further injury sa toang pasyente. And now, first things first, since too much blood loss might cause shock to our patient, then I will try to induce direct pressure on the wound so that the bleeding will stop. So, I have here some cloth. I will directly put it to the left metatarsal of the patient. Kaya lang? Sige lang, relax lang sis. Kaya lang eh. Also, since the bleeding is quite intense, I will be adding another one. So, on open fractures, we have this scaling called Gustilio-Anderson classification, to which they classify types of open wound. We have three types. That's type 1, type 2, and type 3. Type 1 is 1 centimeter na naggawas ang bone sa patient. Type 2, 2 centimeter to 10 centimeter. And type 3 are much more worse that was caused by more intense energy over a fracture. So, on my initial analysis, it seems that the fracture of the patient is type 1. So, I think I was able to stop the bleeding right now since it is our primary concern. I will be calling the 911 since I am all alone here. I will be calling the 911 to call for help. Any open fracture, any fracture at all is an emergency. So instances like this, you should always call for paramedics. So I'll be calling the 911 right now. Hello 911. Natay diri sir, pasyente sir sa Alinita Heights Phase 1, Lot 2, Lot 10 po. Color gray ang gate. And nakapasyente diri na siya open fracture pero gamay lang man siya. About 1 centimeter po sa kanyang metatarsal on the left leg niya po. And yes po. And I have while waiting po, I am knowledgeable and I think I can apply splint sa iyang foot right now. And I am putting direct pressure as of now sa patient po. And he is excruciating with pain right now. And I hope you can go here as po. And while waiting, since ako lang ang patient ang naadere, I will be turning the phone into loudspeaker so that you can give me instructions and update kung asa mo. Alright, sige po, thank you. Sige po. So now, since natawagan na ako 911, we will, since we are able to address the first primary concern, which is the bleeding, now we will try to immobilize the injured part of the patient in order for us to stop possible further injury sa iyang tiil. So there, ano na ako, and I will secure ang ato ang direct pressure. Relax lang sisa. Kaya ra? Ingan lang ko ha, kung sa'yo na feel mo. So first off, the concern will be just on the direct pressure. Kaya ra? Sige, relax lang sis. Kaya nakatawag na ako kung 911. Ano, ganyan pira ha? Ayan, so na-secure na to. Pagkabala ka, din na magtubuin mo ang samad. Okay na eh. So I am able to secure the to stop the bleeding the patient. Now I will be putting splint on the patient in order to immobilize the injured part. So I have here 2 splints. Relax lang sisa. 2 splints that I will be putting on both sides so that it joining the tibia or the shin part of his lower extremity, also covering the joint of the foot to secure the possible movements of the foot. So I will be securing now our bandage. But before that, I will be sis kaya ni may itaas gamay ha? Taas gamay. Assist ka niyo tiin ha? Nako sa baba. Mag-assist ko sa baba. Alright, great. Sige, tama na. Kaya na? Sige, mag-assist ko. Ngayon na to sis. Kaya ako naman isa dali. Makaya lang. Nakabiyaan. Okay. Is there. So, I am able to secure the splint already, and that the patient already immobilized is immobilized on this portion right now. So we will just wait for the paramedics to come, and they are on their way already. So that will be the first part or the last part herein. However, while I was able to secure the splint of the patient, the patient had gone unconscious all of the sudden. It might be due to the continuous blood loss of the patient. So this might turn out to be a case of shock. So I will be extending to further the first aid that I am doing right now. So since the patient had lost consciousness, I will look for a platform in order for me to elevate the foot, the lower extremities of the patient. Sis, unsa ka sis? Okay na, unsa man? Unsa ka? Vince, okay na ka? Wala ka, napuyo pa ng banyo. So now I will be elevating, since this is much more dangerous instance because the patient is unconscious. First hand, I will be trying to elevate the foot to prevent shock of the patient. Secure it, and then check Dr. ABC. First is the danger that we have done a while ago. Next is the airway of the patient. So we will be putting the head of the patient on the anatomical position. We will tilt a little, then open the mouth, and then check for signs of breathing. So I will be listening to if by chance there are breathing on the mouth of the patient, while looking on the chest of the patient if there are movements. So right now, after 10 seconds, I can see that the patient has no breathing response, and so this call for an further emergency. So I will be performing now the CPR for the patient. So on this position, we will be putting our hand on the chest of the patient and straighten up, and we will be pumping the chest of the patient to induce breathing manually by ourselves. So we will do 30 repetitions for about the chest of the patient, and after 30 repetitions, we will be inducing 2 breaths to the patient. So I will be performing the pumps right now on the unit of staying alive. So that's 1, 2, 3, 4, 5, 6, staying alive. 1, 2, 3, 4, 5, 6, staying alive. That's 1, 1, 2, 3, 4, 5, 6, staying alive. Alright, after that, I will be inducing 2 breaths to the patient and look until the chest starts moving. So, since the time of pandemic, though we are housemates with the patient right now, we don't know the odds of COVID. So, to keep things more safe, I have here a tube that would lobby the air from me towards the patient. So I will be inducing 2 breaths. I will be tilting the head of the patient, open the mouth, and induce 2 long breaths. Notice that the chest of the patient is bulging. That means the air had gone to his lungs. And another 2. Then afterwards, we will go back and chest pumps for further. 1, 2, 3, 4, 5, 6, staying alive. 1, 2, 3, 4, 5, 6, staying. 1, 2, 3, 4, 5, 6, staying alive. And we will do once again the 2 long breaths to the patient. So tilting the head once again, open the mouth and breathe. And we will be keeping to repeat the cycle 30 pumps and 2 long breaths until the paramedics will arrive or when the patient gets his or her consciousness once again. So while I am doing it, the patient had regained his consciousness. Nice and sis, okay lang ba sis? Kaya ni mo? Nakuyapan ka. Sige lang. Napadala naman ng paramedics ha, relax lang. So, 2 of the prime concern while ago were able to address. First is the intense bleeding of his left foot. Next is his unconsciousness. And now, since I think he's okay na, just waiting for the patient, the paramedics, I will be checking the capillary test here. If the splint that we're able to make was just enough. And I think that it is okay because the blood had regained its color instantaneously. Also, sis, okay na ka? Kaya na mo? Ilihok lang ito sa mong tingin. Makaya na maglihok? Hindi na makakaya niya? Okay. So, this means intense damage might be inside. Though we have only a type 1 wound. And there, the paramedics had come and I will be endorsing it to the paramedics right now. So sir, we have here at ang pasyente na mo. Bago lang niya siya nakuyapan actually, but I was able to revive him. And I think he needs further assistance po right now. And I administered splint already and stopped the bleeding of his left foot. And you can take over po. This happened about 15 minutes ago po, all the scenarios right now. Yeah. So that ends my final demonstration for the class 103 Sports Science First Aid po. Thank you so much classmates, thank you so much Sir Albert. So this is Neil Ayan Villarin together with my best patient. Sir, kita. Mr. Vince Bacornay saying thank you and sa ulitin. Thank you.
Yung papel, hindi